Hello, and welcome to Rejuvenous TV Skincare Academy, starring one of Hollywood's most sought-after doctors, Dr. W. Ray Henderson, and his beautiful host, Jamie Fierro. Here, you will get all the answers to your daily skincare questions. So stop aging and start living here at beautyplum.com.
Doctor, can you talk a little bit about the difference between cosmetic and reconstructive plastic surgery?
Well, reconstructive plastic surgery involves metabolic disorders, congenital abnormalities, trauma, and the reconstruction, the goal being to reverse to as near normal a function and appearance as you can get. When you're talking about cosmetic surgery, you're talking about purely elective surgery. The person wants to look as young as they feel, so they seek out how they might achieve that.
What does the term board-certified cosmetic surgeon mean?
Well, board certified, whether it be plastic surgery, urology, OBGYN, ear, nose, and throat, ophthalmology, means that you have completed a study designated by your peers that includes all aspects of it, recognizing, diagnosing, teaching, operating on, treating, when to operate, when not to operate, when to get in trouble, how to get out of trouble, and all of the aspects of that particular specialty. And a test is given by professors usually from around the country to deem if you're trained properly to be able to offer these services to patients.
Doctor, can you please explain how one might find the finest cosmetic surgery in, let's say, their city or state?
Well, there's several ways. Number one, they can phone the local hospital and ask for recommendations of board-certified surgeons. I emphasize board certification because it gives a certain amount of excellence to their abilities. They can also phone the American Society of Facial Plastic Surgery and Reconstructive Surgery and get recommendations from them. The American Society of Plastic Surgery, they can do the same thing. Phone their home office and ask for qualified surgeons in their area. Another very, very important referral is from patients who have been treated by a particular doctor, happy with the results, and have had a positive experience, so that that recommendation means a lot because it's a little more personal and I think a better confidence builder. The important thing about referrals is, in my opinion, is to have several consultations so that you have the opportunity to hear different answers and choose your physician based on a feeling you have towards that doctor and his recommendations.
Can you talk about your experience and expertise?
Well, my experience, I was trained in ear, nose, and throat, head and neck surgery at the University of California in San Francisco. Shortly thereafter, I became board certified, which again is going in those days was a 5-day examination at the University of Illinois. And I went to Brazil and did missionary medicine in the mid-70s, and while there I did only reconstructive surgery on cleft lips and palates and pharyngeal flaps and skin cancers and the reconstruction of that particular area we're operating on. I only did one ear, nose, and throat case there, and I restored a gentleman's hearing who was blind, so that was quite a, satisfying thing to do. When I came home, I announced to the hospital I wanted to become board certified in facial plastics, so I did a fellowship with a fellow named Maury Parks, who was the go-to guy in those days in Beverly Hills for nasal surgery and facial surgery, and he was one of the founding members of the American Academy of Facial Plastic and Reconstructive Surgery.
Doctor, can you talk a little bit about how you might determine whether or not a patient is a good candidate?
Well, that's a really, really important question because screening patients is extremely important, and there's no one test that will tell you is this a good candidate or not. You have to develop a technique and a skill about evaluating a patient. Do they have realistic expectations? Are they doing this to maintain a marriage, to get a raise at their job? If they have unrealistic reasons for having surgery and unrealistic expectations, you want to say bye-bye to that patient. So it's somewhat of an intuitive feeling that you have to have. People have tried to develop tests that you can give to patients to determine if they're a good candidate, but you learn by experience.
Can you talk a little bit about if this is a true statement or not? Just because a procedure is highly sought after, does this mean that the procedure is going to be effective for a particular patient?
Not at all. Again, going back to basics, it's what it is that the patient's concerned about. Based on your education and experience, can you realistically improve upon that? And it doesn't work for everybody. There's not one procedure for everybody. You have to individualize every case.